Hello everybody, this is Dr. Aaron Seaton with the Chiropractic Place. Today's video is about the basic concept of chiropractic. There's a lot more to chiropractic than a lot of new patients understand. A lot of people still associate it with just back pain, neck pain, and headaches. And chiropractic is very effective at helping people in those situations. But there are those patients who come in and start responding in other areas of their health that they never thought would be associated with chiropractic care. And so I like to explain this in very basic terms for patients so that they understand how chiropractic can have this massive impact on their overall function and overall health. This is what sold me as a young man. When I first came to the chiropractor at 19, I was having some low back issues, some sciatic problems, but I started to notice under the chiropractic care significant improvements in other aspects of my health. And that was a real eye-opener for me. So I like to explain this to my people so they can make an educated decision about how they utilize chiropractic care moving forward. So what we have here is a representation of the brain, and this right here would be our nerve system. So we'll just put nerves right here. And what happens in the body, we have two ways of communication. The brain obviously sends control signals through the nerve system to the body, and this could be any organ, tissue, or cell, because the nerve system regulates 100% of what we do. So this controls your heart, your lungs, your liver, the movement of your leg muscle. Everything is regulated through your nerve system. So there's a lot of information going to and from. And so as you get signals here, the body also will send signals to the brain about what's going on. And this is that communication pathway that's controlling everything. And so in chiropractic, when things in the spine go out of alignment, the spine acts like the armor that protects the nerve system. The spinal cord and all the nerves exiting out at every single spinal level are protected by that spinal column. And so when those bones go out of alignment and create this pressure, it can kind of block these signals from getting where they need to go. Not 100% of them, but enough pressure in that area of your spine can create dysfunction and dis-ease in your nerve system. A lack of ease, meaning it's not functioning at its very best. And they've actually studied this, physiologists have studied this, that the weight of just a quarter of pressure on these nerves can shut down signals by up to 60%. So that's a big deal. We don't want our nervous system, the master control system of our body, not able to regulate things. So when chiropractors make these chiropractic adjustments, we're getting motion back into that spine. Getting those bones to move properly actually takes pressure off of the nerve system in that area and frees it up. So when we have those situations, that allows for that signaling to kick back in so that your body can begin to heal itself. Now, does it work 100% of the time? Absolutely not. Nothing does. But this is something that if you ask somebody, hey, when you're walking around and wanting to be healthy, do you want your nerve system working at 100% or would you like it working at something less than that? I've never once had a patient say something other than, no, I want my nerve system working at 100%. Well, that's why we like to check our patients on a consistent basis. It's why I get checked on a consistent basis, is so that we keep the nerve system at 100% so that our body can function at its very best. I'm Dr. Aaron Seaton with the Chiropractic Place.